Every mom with prolapse should understand these 3 foundational things when it comes to prolapse healing. Number 1, the diaphragm, core, and pelvic floor connection. Number 2, your rib cage over pelvis positioning. And number 3, pressure management. You can do all the core exercises in the world, but if you don't get these 3 things mastered or understand these 3 concepts, your prolapse healing will be extremely limited. This is also true when it comes to diastasis recti healing as well as leaking. In today's video, I'm going to walk you through what the diaphragm is, how it's connected with your core and your pelvic floor, how we can optimize our diaphragmatic breathing for pressure management, limitations that we might see in the system that's preventing us from healing our prolapse or diastasis recti, and how to check yourself for breathing or how to test out this breathing technique. So let's get right into it. So our diaphragm is a dome-like muscle that sits right underneath the rib cage. And the diaphragm's main responsibility is to help pull oxygen into your lungs to optimize oxygen within the body. So you've got your rib cage that sits here and the diaphragm sits right underneath the rib cage. And as you take an inhale, the diaphragm extends down or descends down, it flattens out so that all of the oxygen can then be pulled into the lungs and it creates space for that oxygen to go. And then on that exhale, everything comes back up. So you inhale, it descends down, and then exhale, it comes back up. With a normal functioning body or normal functioning breathing system, what happens is as the diaphragm descends down, this creates pressure in our system. So it creates pressure in our abdominal cavity, it creates pressure down into our pelvic floor, and our pelvic floor is supposed to respond just like the diaphragm. So you've got the diaphragm here and your pelvic floor here, they're at the resting tone. And so as you inhale, it should sync together. So it should work together as a system. So you inhale, extend down, exhale, it comes up. So these 2 systems, the diaphragm and the pelvic floor, literally work together to move down on the inhale and move up on the exhale. Just like a trampoline, if you go to step onto a trampoline, what happens? It descends down. And then as you jump off the trampoline, it ascends up. And so that's how I want you to think about the core, the pelvic floor, and the diaphragm when you take your inhale in and when you exhale. When we inhale, everything extends down. When we exhale, everything comes up. With this good breathing pattern, this helps to promote lengthening of the pelvic floor, but also strengthening of the pelvic floor as it comes back up. And this also determines on how you're exercising. You have your resting state, you have your intentional breathing, and things like that that can really emphasize or increase pelvic floor activation along with core activation when we use our breath appropriately. So why does this matter for prolapse and pressure management? When it comes to prolapse or diastasis recti or even leaking, pressure management is the key to everything that's happening internally. So if we don't manage our pressure well, then this can create worsening symptoms. This is why we have to focus on the diaphragm, because the diaphragm creates pressure in the system. This is pressure that we need. As I explained before, we inhale, it extends down so everything lengthens, and then as we exhale, everything comes back up. But when we have a broken system, whether from pregnancy or posture or just poor daily habits from gripping and tensing up the body, this disrupts that normal breathing pattern. And so then it leads to diastasis recti, prolapse, and even leaking because the system is no longer moving up and down. Instead, it's moving to the side or just to the back or just straight down instead of a 360-degree pattern. How our breath should be is, like I have my son's toy here, we inhale, it expands in a 360-degree pattern, right? And so this is how we need our breath to go. So when we take an inhale, we need to have that degree. So it's to the front, to the sides, into the abdomen, and down into the pelvic floor. And so inhale, everything expands, exhale, everything comes back in. But when we have a broken system or a not optimal operating system, whether from tightness, this restricts the breath from being able to go all the way around. I'm gonna show you on the balloon of what can happen within the abdominal cavity. So we can have tension all throughout the entire body, and it really depends on your posture, your daily habits that might create that tension within the body. You might have tension all over that's making your prolapse symptoms worse when really we just need to get rid of the tension. And so if you think about it, if I'm an upper ab gripper, for example, and I squeeze the top, then the pressure or the oxygen, the breath or the air that's inside this balloon has to get dispersed somewhere else. Same thing is true if you have back tightness, which is very common newly postpartum or during motherhood because we're constantly picking up kids, groceries, maybe the dog food, whatever the case might be, and then you have back tightness in the front. And so this is going to disperse the pressure to the front. So if somebody has diastasis recti and you have back tightness, all of the breath is going to continue to go through the weakest tissue, which in this case is the abdominals. And same thing is true if you have tension in the back of the pelvic floor. This is going to make it feel like prolapse feels worse because the tissue that's restricted, it has to disperse the tissue somewhere else, making symptoms feel worse. I love using this water bottle, crushed up water bottle visual that I learned from my mentor. When you have a crushed up water bottle, what is the only way you can get the dents out? You have to go internally. So we can't just try and reposition this to get the dents out. We literally have to go inside of the water bottle and poke it out. And so that's how I want you to think about our tension in our body. So same thing with the balloon. If we have pressure or tension, then we have to disperse that material somewhere else. And so when it comes to prolapse, this is happening inside your body. And so while doing internal release with a pelvic floor therapist is extremely beneficial, I highly recommend it. One other way that we can do this is with our breathing and learn to manage that pressure better. When we work on inhaling into sticky spots, for example, say you have tension in the back of your body and we focus on breathing into the back, this helps to release that tissue so that then the breath can move more smoothly, like that up and down in the trampoline. Same is true if you have tension from upper abs, and instead of getting a lateral expansion in the ribs, all of that pressure is going straight down into the pelvic floor. So instead of expanding, having that even spread load, the pressure just goes straight down onto the pelvic floor, creating lengthening, more lengthening within the pelvic floor than what it needs, because it actually needs strengthening. Some cases it needs strengthening, some cases it needs more lengthening. Okay, now let's talk about the rib cage stacked over the pelvis. When we don't have an optimal position within the body, then same thing, the pressure is going to be dispersed somewhere else. So the most common position or the two most common positions that I see is a open scissor position. So anterior pelvic tilt, it's dumped forward and rib cage is flared up. If we have a rib cage that's flared up and a pelvis that's shifted forward, all of that breath is going to be dispersed here because we most likely have tightness in the back that is keeping that breath from going. Whereas on the opposite spect, or the opposite, we're tucked under and our rib cage is tucked down and we're shoving those hips forward, we're going to create this lower belly pooch that's going to create, again, more pressure down onto the pelvic floor. Whereas when we have a nice, good rib cage stacked over the pelvis, I like to take my pointer fingers on my hip bones and the bottom of my rib cage. When we have this good stacked position, the breath can move smoothly down and smoothly up, and then also in that lateral rib expansion. And so that's why it's really important, especially with exercise and especially throughout your day, that you pay attention to your body and what you're feeling. Are you an upper ab gripper? Are you putting those abs down, creating that lower belly pooch? Are your shoulders rounded forward? Do you have that forward head tilt? Are you tucking the tailbone under? Or do you have more of that open scissor position? Once you identify what position you tend to lean in, then you can start to become more aware of the position of your body, because we really need to have that rib cage stack to have that smooth, easy breathing pattern within the diaphragm, the core, and the pelvic floor. Now we're going to put it into practice. Now we understand how the diaphragm works. We understand its impact on pressure management and how it impacts the pelvic floor lengthening and strengthening. And then we understand the rib cage stacked over pelvis, and we understand that tightness could be keeping our body from truly healing. So now that we understand that, now let's put it into practice. We're going to do a very simple, basic breathing exercise in a supine position. What I really want you to do is to take a video like you see above of yourself, ideally with a sports bra and below the belly button, so you can see where the breath is going. Because when we can see where the breath is going, we can then say, okay, I need to work on getting expansion into the back. For me, I really had to work on getting my breath into the posterior retain. So the posterior pelvic floor and my low back is where I saw most of my restriction when it came to breathing. Very important that we want to think inhaling through the nose and expanding to the ribs. So ribs should expand to the front, they should expand to the side, and then it should expand into the back and then down into the pelvic floor. And as well as the belly. And so that's what we call a 360-degree breathing. We want to evenly spread that load. But when it comes to your prolapse journey or your diastasis recti or leaking, we have to identify where there's tightness in the body so we can then recreate that pressure to go into those spots so that the breath isn't just going into the abdomen. Because like I said, if you keep breathing breathing, belly breathing, and you have back tightness, this is going to continue to create lengthening in the tissue of your abdominals, which is going to keep your diastasis recti from healing. Or if you have just that straight up and down, so say you're an upper ab gripper and all of the pressure is just going straight down into your pelvic floor, you're not getting that evenly spread. The tissue of the pelvic floor is just going to keep lengthening and you're just going to have that dragging sensation. That's why we have to identify the tightness. I want you to take a video of yourself so you can see, okay, I can see the breath in my belly, I can see the breath in my ribs, but I don't see it in the back. You're then going to work on getting your breath into the back through various techniques and exercises. So I'm just gonna walk you through a super simple supine position. I'm just gonna walk you through a couple breaths so that you can learn and to start to practice on yourself. And if you want to advance your knowledge on this or really go a little bit deeper, make sure to sign up for my free pelvic floor blueprint. I have a couple more videos explaining the diaphragmatic breathing and different techniques and different exercises that can really help support you in this. Okay, go ahead and join me down on the mat. If you need a pillow for head support, don't be afraid to grab it. So I'm gonna have you place one hand on your rib cage because what we wanna feel is we wanna feel expansion to the front, laterally, and then into the back. So I've got my thumb on my back and then I've got my 4 fingers on the front. And then I'm gonna place my other hand on my belly and I'm gonna see where the pressure goes. So I want you to think about suctioning the tongue to the roof of your mouth and then I want you to inhale for about 4 counts. So go ahead and do that with me now. So inhale through the nose for about 4 counts. And then exhale, I want the breath to come all the way out from the mouth. Very gentle. Okay, let's do one more just like that. Inhale through the nose, suction the tongue to the roof of the mouth. And exhale. Let all of the breath come all the way out. Okay, now I'm gonna have you place your hand underneath your back so you can see. You can place your hand underneath your back to see if you can feel the breath there as well. We're gonna inhale through the nose for 4 count. And exhale all the way out. Let's do that one more time. Inhale through the nose for 4 count. And exhale all the way out. All right, so what you should have felt is you should have felt your rib cage moving to the front, to the side, and to the back. And then when you had your hand on your belly, you should have felt your breath going into your belly and then your breath going into your back with your hand. Now that is just a simple diaphragmatic breathing, so focusing on getting the breath. And sometimes we just have to place our hands on our body to really wake up those muscles. And once you've mastered that, then you can do more of intentional breathing. So when you have more of a pursed lips, like that's when you can really get those abdominals on board, whereas what we just did is more of a relaxing exhale, so the pelvic floor and the core slowly come in. Now, a couple things that you want to notice or look at when you take a video of yourself, I'm going to share my video down below with some instructions, is paying attention to your abdomen. Does your abdomen flatten on the exhale or does it pooch out? This can give us an idea of what's going on and having that reverse breathing pattern. Does your breath go up? So as you inhale, does your chest lift and your diaphragm almost hollows out? So underneath, pay attention to underneath your rib cage. Do you get a hollowing out of the rib cage or does it spread out? Does it expand out? And so these little things can really help us identify, okay, what's going on? Another thing I like to see is when looking at somebody's video is on the inhale, their back lifts up. So instead of the back extending with our breath, it actually lifts up, which also tells me that they really are struggling to get their breath into the back. So pay attention to a couple of those things. And like I said, just record yourself breathing and where do you see your breathing. Now, when it comes to activating with the core and the pelvic floor, we could be a little bit more intentional with it. So instead of doing a nice soft exhale, we could do more of a forceful exhale. And you can place your hands on your abdomen to see what I'm talking about when I say this. So you're gonna do that 4 count in, suction the tongue to the roof of your mouth. And then on your exhale, you wanna think about exhaling from the bottom up with pursed lips. So, and allowing your breath to come all the way out will automatically turn your core on. Give it a try if you know for a fact that you do not have tension in your pelvic floor. If you have tension in your pelvic floor, I want you to exhale gently. But otherwise, if you don't have tension and you need to activate the deep core, then you can work on that as well. And then later down the road, we start to add balloons and straws to our breathing to really maximize our core and pelvic floor results. If you are ready to dive right into this and get all of the tools that you could possibly imagine, follow along videos, corrective exercises to really start eliminating leaks, improving prolapse, and reducing diastasis recti, make sure you check out my 4-week pelvic floor and core program, Core Revive. This is a 4-week program, 25 minutes or less, full follow-along videos to help you reduce the leaks, improve prolapse, and start to see a change in your core. Let me know what you would like to see next on this channel, and make sure you hit subscribe and share with a mama who needs to hear this.